Hello and welcome to another episode of Inspiring Women Leaders. Today, I'm really excited to welcome to the show my friend and physician leader, Dr. Carolyn Moyers. Dr. Moyers is a board-certified OBGYN, entrepreneur, podcaster, wife, and mum of 4 kids. She's the founder of Sky Women's Health in Fort Worth, Dallas, a direct care boutique gynecology and osteopathy practice. Her niche is providing solutions for back and pelvic pain in both pregnancy and the postpartum period, so that women can enjoy their pregnancy and their newborn on their own terms. Her weekly episodes of Sky Women podcast share the power of women's stories, empowering them with education and inspiration to live their best lives. Most recently, she launched her own website, which is www.drcarolynmoyers.com, and I'll put all the links in the show notes, to help other women physicians who still love their field of medicine but dread going to work each day live their lives by design. What an incredible mission, and I think it's fair to say that Dr. Moyers is leading the way with inspiration. So without further ado, let's meet Dr. Moyers. Welcome to the show, Carolyn. Thank you so much for agreeing to come on and speak to the show's audience.
Oh, thank you so much for having me. It's such a pleasure. I'm delighted to be here.
Oh, thank you. Okay, so should we start with you telling us a bit more in your own words about yourself? I mean, I've been through the introductory bio, but a bit more personal, including a bit more about your current roles, if you'd like to elaborate, and what leadership positions you currently hold or have held in the past.
Yeah. So like you said, I'm a wife and a mom first. I have been defined by my career as a physician for so long that whenever I kind of took a step back to spend more time with my family, I felt this internal conflict on the daily. Just, is my career passing me by? I've worked for 13 years to be here, and now I'm working as a hospitalist and very part-time. And what does that say about me as a physician? And, it's been an evolution. And so so it was around year 5, as an attending, where I felt like I was consistently either disappointing myself, my family, or my patients, right? If I chose to pass off to the on-call physician to go home and put my baby to bed, then she may be upset with me, or she may transfer her care to the doctor who actually delivered her. Never mind, it's 10 p.m. and I've been here since 7 a.m. And, doctors need rest as well. And so when I was having my 3rd son, I decided that I was going to do part-time work as an OB hospitalist. And that was a new concept to me, but it was close to my house, and it really allowed me this more time and space to kind of do things on my terms. Yeah. And it was actually during that time that the gentleman who had started the program at that hospital, because I started at the inception of the OB hospitalist program at this particular hospital, he said, you just have a calmness about you and how you interact with the staff. And I would really like it if you would consider being our medical director. And I thought that was really interesting. And even friends were like, what? They let you be the medical director as part-time? And I was like, yes. And is that unusual? I don't know, because I just stated what I needed. At that time, at that phase in life, that's what I needed. And I was willing to ask for it. And I just showed up with the, with my integrity, with the way that I interact with nursing staff and colleagues and patients. I really want to take the best care of patients, and we're going to work collaboratively to do that. In medicine, you don't do anything as a silo. It's a well-oiled machine. And just showing up in that capacity allowed me this opportunity to lead and deal with employee relations and things of that nature, and a lot of clerical work as well. Like, let's not be kidding. When you're the medical director, you do a lot of clerical work.
Yeah, unpaid as well.
Yeah. But aside from, kind of being my somewhat my own boss as an employed physician in my own practice setting, but under the management of a hospital. This was kind of my first stepping outside of the box and somebody recognizing this quality in me and saying, hey, would you fill this role? And so from then, I really haven't done anything that I'm not the leader at. So I helped develop a GYN program for there's a hormone replacement therapy that has 6 different locations in the state of Texas, and they wanted to globally throughout their company develop gynecology services. And so I helped to develop that, protocol and training and all of the things. And it was a lot of fun. And as I did it, I thought, wow, if I can figure this out for somebody else, I can do this for myself.
Mm.
And that's what kind of led me on the journey to opening my own practice. But, it sounds like it's so linear, and it was not. It was very circuitous getting there. So I spent 2 additional years after deciding, I really want more. What am I going to do? I came back to OB hospitalist work full time as a holding place to give myself space to kind of really map out what I wanted to do in my practice. And I started my practice in the middle of the pandemic. It's a great time to start your practice. Right? Very, people sometimes say, how do you do this all? And why would you do this? And, I just really started with the vision and the mission. And I let curiosity guide me in how I lead, because I know I don't have all the answers. But I'm pretty sure that I can find somebody who does, or I can find the resource that does. And I'm not scared to ask and to look like a fool when I'm asking, because nobody teaches you the business of medicine. Nobody teaches you how to think outside the box and to dream. Really, I feel like that's squashed in our medical education, right? It's very, very well laid out. You're going to do X, Y, Z, and then you can be an attending, and maybe you'll get to be a partner. And, all of these expectations are laid out for us in medicine. And as I walk the halls of the hospital, you see all the plaques and the pictures of the people who have been, chief medical officer or whatever. I just, had this very strong sense of knowing about myself that this was not the path that I wanted. I wanted an opportunity to really treat women authentically, to know them well, to give them time and space to be heard. And I don't know, Adam, if you've even heard the story about why I named my practice Sky.
No,
So,
please tell me.
Okay, so I was a baby attending, first year attending in 2010, and I read the book Half the Sky. Have you read this before?
No.
Okay, so Half the Sky is a book that tells accounts of young girls who are abducted and forced into prostitution, who are rape survivors, who, just the lack of priority of education for women globally, horrific retellings of maternal mortality. So, therein I'm hooked, as an OB, and genital mutilation. And I saw a lot of genital mutilation in residency training. And so I could not put this book down. And it really is a call to action. So there's all these resources in the back of the book that give you resources for how you can get involved, right? Mm-hmm. So I carried this with me for 10 years, just always thinking about this and agreeing that, yes, women hold up half the sky. So the name of the book comes from this Chinese proverb. So as I was dreaming about designing this practice, I realized I didn't have to partner with some global organization to impact women's health in a big way. In my own community, women are so busy taking care of all the people in their lives, and they're often feeling dismissed or hurried in the healthcare system. And I wanted to just change that narrative. I wanted to provide the time and the space for quality, personalized care and really revolutionize how women take care of themselves. And so I named it Half the Sky. I named my practice Sky Women's Health after that proverb, women hold up half the sky, because I believe that women deserve direct access. And whenever women are empowered, big things happen for their families, for their children, in their businesses, and in their communities. And so that's really my why. And in trying to design that, I've done Dr. Una's Entre MD Business School coaching. I have worked with Latifa to get my mindset around money and, the Money Fit MD doc. I did self-coaching scholars with the Life Coach School with Brooke Castillo. I did Empowering Women Physician coaching with Dr. Sunny Smith. I mean, so many women who I had to seek out because in my own training and setting, other than the motto of kill 'em with kindness of our residency director, I really didn't have a female role model to guide me until I was talking about this with a colleague, a midwife actually, who is a practice owner, and said, every time I hear you talk about the kind of practice that you want to design, it makes me think of Dr. Camilla Smith, who owns Charleston House in Dallas, Texas. You should go meet her. And we were fast friends. And she was the first woman that I'd ever met in medicine who really was of this mindset of women empowering women. And it was just like to her core. And she said, you want to franchise what I'm doing. You want to do your own thing. I will support you. I will help you. I will show you how I did it. I'll tell you how I did it. But figure out exactly what is your secret sauce. And she said, you are the secret sauce in the practice, but what is that secret sauce that you bring? And that's when I kind of came back to this fellowship that I did in neuromusculoskeletal medicine and decided to just put my own crown on as the pregnancy pain doc.
Yeah.
Yeah.
Oh, thank you so much thank you for sharing that origin story of the name. That's so powerful. And it's very, very inspiring. And I mean, such a great thing to come out of such tragic stories, to inspire you and kind of lead you to want to empower women from so many tales of disempowerment and loss of autonomy. And, my goodness, that's absolutely wonderful. Thank you so much for that. I'm really grateful for that. Well, I mean, I think you said towards the beginning that you were appointed as a medical director in your first medical director role because of your, kind of your serenity, the aura of calmness that you bring. And I know what a wonderfully kind person you are. And I'm just wondering how all this kind of fits in with your personal leadership style and how your personality impacts upon that. And
yeah, so one of the things that was said to me was, you don't get involved in the fuss, in the drama, and I thought, that's right. So my idea or at my core, like I cannot stand backbiting. It is not a part of who I am. I don't want to be involved in that. And I do as an OB-GYN, you are helping people in very critical, very emotionally, highly engaged situations. And so I do have to be the captain of the ship and I have to be calm in those scenarios and bring, this calmness and to make everything function properly, right? Understanding that I may be equally scared.
yeah.
And so I think that, just showing up with enthusiasm, with, this kind of, I feel like I'm more of like a coach and a visionary. Okay. So whenever I'm leading, I want people who they're in it for the right reasons, right? They have bought into the vision and we're going to go. One of the things that my lovely husband had said to me whenever I was dealing with negotiations and deciding if I was going to collaborate with another individual, he said, you're not looking for captives. Like, either they want to be on the ship or they don't. Like, you're not holding anybody captive, And so I think I've always kept that in mind is like, either it's a good fit or it's not, either it feels right or it doesn't. And I think that as a lot of times women, we tend to ignore that intuition that we have. that kind of that feeling, that knowing, that inner knowing. But I really think that that's a superpower for us. Yeah.
Yeah. Yeah. And obviously you that's part of your leadership style and kind of what directs you in that.
Yeah.
Yeah.
So I'll tell you, Adam, so I have designed just this very simple model with my practice. I mean, it's a direct specialty care, essentially. We're not involved with insurance, which I'm sure it's different because y'all have more socialized medical coverage, right? So
Yeah.
not the same in US. A lot of times we're spending almost $1,300 on our family's monthly insurance premium, still having maybe a $10,000 deductible and still things not being covered,
Yeah.
So
Yeah.
it's quite interesting. And so I chose, I could have gone either way, and I chose a direct specialty model because it just made sense to me. I wanted to simplify care. And so I have one nurse who works with me, and I didn't seek her out and hire her. She came to me and said, I want to be a part of this because I started talking about it on social media about, gynecology reimagined and how we do this. And she was a mom friend who happened to be a nurse who had been a stay-at-home mom for several years and had her own, tragic story, losing a spouse, etc. And wanted to be a part of the vision.
Yeah.
And so I sent her over my vision that I had typed up with, how do we serve as a company? What are our core values? And basically, said, give me your thoughts. Does this sound like something you want to be a part of? And she's been my ride or die from there on, and I've even thought, as we grow and I need to hire, how do I find that next right fit? Because I'm not looking for somebody just to fill a seat. I'm looking for somebody who shares in the vision.
Yeah.
And so I think being careful, to bring people into that, because your vision or your entrepreneurial journey or this idea that you have that you want to birth is most vulnerable in its infancy stage, right?
Yeah.
And the more people that you get involved, the more muddy that vision can get.
Yeah. Yeah. No, that's very true. Yeah. And I like this sort of postpartum analogy as well. Very appropriate for your specialty. So
I can't help myself.
No, I love it. I love it. I really do. Well, I mean, you told us a bit about your journey to leadership already and how you were appointed a medical director, and it sounds like you were there at the inception of that particular OB unit, and your senior colleague, just thought you were the right person, you were the right fit. So I'm guessing that he kind of helped you rise. But were there any other doctors in your career so far, female or male, that have helped you?
Yeah. So I had a male attending as an intern who was new to our program, who was really a great mentor. And similar to you, Adam, he was really of the he for she mindset, of empowering women. And so he was a great asset to me through my training. And then as a young physician, I really did not have a lot of mentorship and guidance, and it felt quite lonely. I was lucky enough, I did a rural health commitment right out of residency, and I was lucky enough to be in a community with other very well-established physicians who were lovely to me, right? I could call on them for any time. So I guess I wasn't alone. Like from a medical standpoint, they would show up in the OR anytime I needed help. They would let me run a patient by them. They were very supportive and loving.
Yeah.
But in terms of growth as a physician and where do we want to go from here in the career, aside from just standard primary practice, I really didn't have any leadership. And it wasn't until I feel like, call it a midlife crisis or an awakening or something, in the midst of this, taking a step back and taking time for my family and working more part-time, that I really started dreaming about something different. And then I really started building relationships via social media, which I find so interesting because I barely used Facebook in years past. Like I barely touched on social media. And now I can't get enough of these relationships that have been built through social media, so that whenever I went to the Authenticity, Courage, and Empowerment for Women Physician conference recently, it was through my connections through social media, through showing up in the Empowering Women Physician coaching program, which I was invested in myself to learn from these women, that I was even given the opportunity to speak at the conference. And walking into that conference was like walking into a room of friends, but I had not ever met one of them in person.
Yeah.
But I knew them all through our social media connections.
Yeah.
Yeah. So Dr. Una, Dr. Latifa, Dr. Sunny Smith have been huge parts of my personal growth just in the last 2 years.
Yeah. Oh, excellent. And I think you mentioned before that the female doctor who had her own clinic in Charlestown, was it?
No, it's in Dallas. It's called Charleston House, and
Charleston House.
she is phenomenal, and she has been a great mentor to me. Mm-hmm.
Yeah, yeah. Oh, excellent. Thank you. So it's been lovely and positive, and I don't want to bring any kind of like negativity and to the conversation. But
yeah,
have you experienced any challenges on your leadership journey? And if so, how did you cope with and move past them, just so that the listeners can, see that it happens and then learn maybe some techniques to navigate these situations?
Yeah. So as I think about this, I'm like, well, yes, I've had harassment and bullying in different ways, whether it was, the chief resident who called me post call to yell at me and scream at me because of a note that I had passed to a junior resident with an idea for a solution to whatever problem she was going through. And it wasn't his and it wasn't my place. And, I didn't attend to the hierarchy, by nurturing and having an idea for a solution for her. Or, the attending who put his hand on mine and told me he loved me as a young married intern. I mean, things have happened along the way. Or when I was pregnant and big in the operating room, and the urologist talking about I looked like I was going to pop, and making just all kinds of lewd comments, or in the physician lounge, an attending walking up to my colleague who I was talking with, who was male, and saying something about my appearance, or commenting on the size of my breast when I was pregnant. I mean, these things are just prevalent, and it happens all of the time towards women. And I don't know, men's experience in harassment, but I just feel like this is all too common, that we're allowed to comment on women's fertility. We're allowed to comment on women's bodies, and play on these insecurities that have been built into our society. And I just think it's BS. Now, in terms of like my leadership journey, I've done this thanks to Dr. Suba, who is a male who is a male who invited me into this role as the leader for, or the program director for the OB hospitalist program, who recognized that characteristic in me. He's always been kind and supportive to me, but this leadership journey really I have fostered through women, because I want to learn from women, because they understand all of it, all of the things that we juggle, all of the comments and the lewd remarks that we go through. I think that they just really get it. And so I wanted to learn from other women.
Okay. So when you have these, it sounds like, quite a lot of these individual unpleasant scenarios, did you then kind of turn to other female colleagues to, who obviously would have empathy with you for those situations because they've been through very similar? And is that how you kind of, debriefed with them and took their advice? Is that how you kind of navigated these situations?
Adam, I am a true optimist. And I don't know that I really dealt with these well as a young attending. You know, I think that I just, like let it slide off, maybe chat it with girlfriends or
Mm,
a mentor of some sort. Um, I don't remember ever like taking this to counseling or to coaching.
mm.
It wasn't until recently that I have really started utilizing coaching. So really, I just think I let it roll and thought like, this is what we all go through. Like this is
Yeah,
just normal. Like I wasn't even alarmed by half the things that were happening because it was just so
yeah,
prevalent.
yeah, yeah. I know. Yeah, well. I was about to say I know what you mean. Obviously, I don't know what you mean, but as in when I was bullied as a young doctor, um, I didn't tell anyone about it. But I didn't know that everyone was going through similar things as well because the prevalence of workplace bullying in medicine is so high. Um,
Right.
but um, you know, I think there's something about, I don't know if it's I think it's exclusively medicine, but it's very common in medicine, isn't it? That it's just an expectation that you're just going to have to put up or shut up, basically, and just kind of
Yeah.
go through this crap, basically, and that's what everyone else does. It's just we're resilient people. We just have to cope with it. As sexist and misogynistic as it is, that's just the culture. Just have to deal with it.
Right.
Um, but
And you
it,
fear the retribution on yourself if you were to speak
yeah,
up. Yeah.
yeah, very much so. Um, but hopefully, through your podcast and my podcast and all of the amazing work that a lot of our classmates at Trinity Business School are doing, we're kind of raising awareness so that people A, know it's not okay, and B, know they're not alone, and C, they now have resources to go to get help and people that they
Yeah.
can approach. So
Yeah, I think that
it's
that's a really good point, Adam, is that it's whenever we speak up through those shared lived experiences, there's a lot of power because
yeah,
then you're like, oh, me too. I'm not alone. And
yeah,
to know that you're not alone in whatever scenario you're in, whether it's
mm,
leadership, whether it's bullying, whether it's the postpartum period, whether it's menopause, like,
yeah,
knowing that you're not alone in that journey goes a long way.
yeah,
You almost feel validated in those feelings or experiences that you've had.
yeah, yeah. That's I was coaching a surgical resident this morning, and the word validated was exactly what she used. She felt that she was being singled out and picked on by her attending, and she actually went to um, challenge him about it diplomatically. She was afraid. I kind of talked to her about it in a previous session, and I tried to encourage her to be brave and confident about it and take the conversation to him. And she did that, and she went to his office, and she was outside his office, and the door was ajar, and there were another couple of male doctors in his office with him, and there were some raised voices and words like sexism and formal complaints and things being mentioned. Medical
Mhm.
director, that term was used, and it turns out she didn't obviously want to. She felt really uncomfortable hearing this. She didn't want to eavesdrop, but she heard that a senior female colleague of hers had raised a complaint about his sexist attitude.
Mhm.
And but as soon as she heard that, and she'd um, she'd already had a conversation with him, like the day before or something. But she just said to me, I just felt so validated to hear that there was another female doctor who was making a complaint about him, because
Yeah.
I realized it's not in my head, it's not me, you know. And she
Right.
wasn't,
Right.
I was like, well, because obviously there's a risk of you feeling like you've been gaslit otherwise. But now
Oh, and that'll
with
happen
that,
for
so
sure.
yeah,
For
yeah,
sure.
yeah, yeah. But
Yeah.
yeah, no, that's a really good point. Thank you. Um, yeah, so thank you for kind of explaining that and how how you've kind of probably self-managed some of those challenges that you've had. I think it's fair to say, isn't it?
Yeah.
Because you felt they were just par for the course,
Yes.
basically. But do you have any other advice for the listeners on how to become a strong and kind leader, which is very much how I see you?
Thank you for that. I think that you have to just first have your own back. Never be scared to let curiosity kind of be the guide. Like, I don't know, could I fit in this role, or could I speak up, or could we do this program? Like, never be scared to ask. Know that you have great value in showing up as you are. So I will say that in that leadership role, whenever we had roundtables with physicians of all different ages and stages in their practice of medicine, I always felt very insecure, inadequate. The whole, we haven't even talked about imposter syndrome, but I mean, that's just so common. And I've been floored at how common it is among women physicians who I see as tremendous badass, and I'm like, how could you ever feel that way? And then I realized I had to turn that around on myself. But speaking up in these circumstances, I always felt a little, like out of place, and maybe I didn't have a lot to add. And I was so honored to have a woman who is probably 20 plus years my senior, another colleague, physician, say to me, Carolyn, when you speak up, people listen. And I was really taken back by that because, you're in your own head and you feel like you sound like an idiot a lot of times. Or is that just me? Is that just me, Adam?
No, definitely me all the time.
So to hear her say that, I was just really, really just honored. And I just said, okay, I'm going to receive this. Because you know how oftentimes you hear these compliments and you're just like, oh, no, not me. I just decided I'm going to receive that because there was no ulterior motive in sharing that with me. And so sometimes it takes just stepping back to truly see yourself and how you do show up and how you lead and how you're perceived. And I've always done it with a smile. And I have done it scared. I've walked in that fear and shown up anyways. And, as I designed my practice, as I thought about, starting this podcast, all of it is foreign. All of it is slightly terrifying. But I just said, well, imagine a space where we educate women about their mind, body, and spirit. So then I have to be dedicated to that growth daily through educating myself. If I want to empower women, then I have to empower myself. We have to step into that power of who we are and kind of own our worth and be the best version that we envision. And if we want to inspire, then we have to be inspired. We have to be looking for inspiration and we have to be taking action on it. And so this is how I have really just decided I'm going to show up. This is how I've decided that my practice is going to run. This is, imagine a space where this is the expectation and we hold each other accountable. That is what I have decided that I am going to create, where I want women to feel smart and empowered and inspired, whether it's my patients, whether it's my staff, and especially myself, because I can't show up fully as myself and help other people get there if I'm not owning that.
Yeah. That's really true. And I love that. Thank you. Thanks so much for sharing that. And I think that approach will encourage a lot of our listeners, to just kind of step into it, own it, and start ignoring the inner critic that tells them that they don't deserve a seat at the table and that they're, and just to use their voice. Yeah, thank you. I love that. So, do you have a kind of in a nutshell nugget take home leadership message for us?
Um, Take home leadership message. Um, I think be brave,
Mhm.
show up even when you're scared,
Mhm.
and don't be afraid to do it your own way. And pay it forward. So
Yeah.
one of my greatest privileges is to have other female physicians come to me and ask questions and want to coach and counsel with me and dream about what they can do because somebody did it for me.
Yeah.
And so there is there tend to abide by the principle of abundance.
Oh,
That's something I definitely like work on my mindset around abundance,
yeah.
because in medicine it's very much this scarcity. Like if I achieve, then you can't.
Yeah.
There's only one seat at the table for this hierarchy, right? And and that's just not true. There
Yeah.
is plenty to go around,
Yeah.
and even as an OB-GYN on social media, I'm looking at all these others and comparing. I have to
Yeah.
shut out that noise and say that my voice matters, and my voice is going to reach somebody in a different way
Yeah.
than, Mama Dr. Jones does, right?
Yeah.
She has an amazing platform,
Yeah.
but I'm not Mama Dr. Jones,
No.
right? And so you each have your own secret sauce, and you just have
Yeah.
to be willing to own it.
Yeah. Yeah. Totally agree with that. Yeah. The people that are meant to kind of work with you or be treated by
We'll
you or
find
whatever, they will
Yeah.
find you. Yeah. They're your tribe. It's like us, and your podcast guests and my podcast guests, and
Yeah.
Dr. Una has brought us all together. We've just
Yeah.
love it, love it. Okay, so what are you currently excited to be working on that you'd like to share with the listeners?
So I have this little idea in my head that has been birthed this week, and
Mm.
it's around female CEO physicians. And so I'm not really ready to share it with the world, but I've
Okay.
put it out there to a couple of close entrepreneurial friends, and I'm excited to kind of see where this goes. Not that I need one more
Cool.
thing on my plate, but I think that learning from female physicians really matters for the younger generation and
Yeah.
even those who are looking to transition. And how do you CEO as a female physician?
Yeah.
Like we're asking Dr. Google,
Yeah.
dear Google, what is a
Yeah.
CEO? And we're not necessarily going to fit into that standard box because I think that women lead in a different manner. And so I'm really excited to kind of develop this idea and bring along women along with me.
I'm very excited to see what that births as and grows into. That sounds great. Yeah, I should be looking out for that very
Yeah.
excitedly. Um, Wonderful. Okay, so if any of the listeners would like to reach out to you, what's the best way for them to do so?
Yeah, they can find me on social, on Instagram or Facebook, at Dr. Carolyn Moyers, and that's Dr. Carolyn Moyers. Or they can find me on with my practice at Sky Women's Health, on both Instagram and Facebook. Or they can just email me at Dr. Carolyn Moyers. It's Carolyn at drcarolynmoyers.com.
Cool.
I also have a website that's Dr. Carolyn Moyers for coaching women or counseling women on making transitions and to really live a life by design.
Mm.
And that is the thing that I just cannot do right now. I don't care if it's my hairdresser or my massage therapist or like I am like helping create business cards and I'm like talking about business models. And
Yeah.
I mean, it's just, I can't not do it. I just love this concept because I feel like I came from very disempowered women and, just kind of owning this power myself and the
Yeah.
women who have fed into me over the last 2 years. I'm ready to pay it forward. So
Yeah.
if there is a woman physician who's dreading her day-to-day work life and wants to talk about transitions and wants to come up with a plan or has an idea and is trying to figure out really how to mold it and where to take that, I'm so happy to help.
Brilliant. Brilliant. I'll make sure all your links are in the show notes, and the podcast and so on as well, all of that. So
yes, I forgot. Yeah, you can find me on any of your major platforms where you listen to podcasts. To listen to Sky Women, real women, real stories, real inspiration,
and the occasional man.
That's right, and the occasional
man. Brilliant. Thank you. So do you have any closing words that you'd like to share before we close?
Just thank you so much for the honor of being here and for starting this podcast to highlight women physicians. I think it's so important that men are a part of the solution when it comes to the equality of men and women. And you really are going to help transform the next generation by highlighting women in leadership.
I hope so. I hope do my little bit anyway to facilitate that. So thank you. Thanks for that. Well, thank you so much again for coming on the show and sharing all your wisdom and wonderful advice with us. And thanks to everyone for listening. So until the next episode in 2 weeks, I wish everyone health, happiness, and inspiring leadership. Take care. And thanks,
yes,
Carolyn.
and make sure that they go and subscribe to your podcast so that they don't miss out on an inspiring story.
Thank you very much. Have a great day.
All right, you too. Bye.
Cheers. Bye.